Good afternoon, board members. Today I'm presenting a strategic study on cardiovascular disease in African American women, highlighting key disparities, a strong research design, and insights to guide policy and leadership. Your support is vital to driving real change. Cardiovascular disease is the leading cause of death among African women. Despite awareness efforts, this group continues to experience elevated rates of hypertension, stroke, and heart failure. Our goal is to investigate the root causes and design targeted interventions. The problem is persistent and multifactorial. African American women face barriers at every level, from prevention to treatment. Our study will examine how these barriers interact with biological risk factors to drive poor outcomes. Epidemiology studies how, why, when, and who gets diseases by analyzing patterns across people, places, and time. It helps us understand disease resource allocation and long-term health planning. It also helps shape effective public health policies. By identifying risk early, it helps us improve care delivery and reduce unnecessary spending. In 2021, CVD caused over 20 million deaths globally. It is the #1 killer in the US and worldwide. CVD is driven by multiple factors, namely aging, lifestyle choices, and social conditions, which all contribute to CVD risk. Most CVD deaths, unfortunately, occur in low and middle income communities where prevention and care are limited. Epidemiology helps us track and identify risk factors and understand who is most affected. The core epidemiological concepts driving CVD risk assessment and modeling. We have incidence rate, which tracks new cases over time. For example, 1% heart failure per year. Prevalence is the proportion of a population that has a specific condition or characteristic at a given time or over a defined period. Relative risks shows us how much more likely one group is to develop disease. For example, smokers are 14 times more likely than non-smokers. Risk models. These often miss women and minorities. Advanced tools are available and they help, but gaps still remain. Social determinants of health affect access to care, lifestyle, and outcomes. Outcomes represent up to 50% of health results. Local efforts like the West Philly Skills Initiative and CHOP's Food Pharmacy are actively addressing these challenges. Good data will help guide and expand these efforts. We must measure income, housing, care access, and health outcomes. We propose a prospective cohort study for the research designs. This allows us to track exposures and outcomes over time, providing actionable insights. Its strengths are disease tracking, and it supports causal inference and captures multiple variables. The limitations are higher cost, long duration time, and risk attrition, which we propose we will mitigate through community partnership, incentives, and robust data system. Ethical integrity is paramount. Therefore, we will ensure informed consent, protect privacy, and engage community leaders to build trust. Chest pain is often experienced, and it comes from non-heart issues like digestion, lungs, muscles, or stress. These can be confused with heart problems, leading to unnecessary tests or missed care. Clear diagnosis is key. Mislabeling cases can skew research and inflate numbers. To improve the accuracy, we will use standard measures like blood pressure and cholesterol, and we will combine medical and social data for a full health picture. Randomly sample and include diverse, underserved groups. This approach will ensure better data and fairer health outcomes. As administrators, we must check the study quality to make sure the research is using solid methods and reliable data. We must promote fairness by including all groups, especially the uninsured, and in the data collection. We must align interventions with the local needs. Lastly, we must use data for action, meaning that good data must be turned into smart policies that truly help the community. In conclusion, credible data starts with strong research and bias control. We will get it, and when we get it right, we can target resources effectively, uncover and reduce disparities, improve cardiovascular outcomes. This is more than a research, ladies and gentlemen. It is a strategic investment in community health and organizational impact. I urge the board to champion this initiative and help turn insight into action. Thank you all for your time and attention. Enjoy the rest of your day.